from a central venous catheter, the preferred method. Equipment needed: blood transfer device, female adapter, a stopcock, 3 or 5 ml syringe depending on the volume of the specimen, CHG disinfectant pads or Pediatrics, 2 pre-filled 10 ml normal saline syringes for initial flush and waste and for flush after sample, heparin, if not infusing fluids, patient labels, and specimen collection tubes. Perform hand hygiene and don non-sterile gloves. Assemble the 3 or 5 ml syringe, 10 ml pre-filled normal saline syringe, and the stopcock. The male end of the stopcock attaches to the injection cap. Syringes attached to the female end of the stopcock. Prime your stopcock system. Turn the stopcock off so it is off to the empty syringe and prime with normal saline, discarding excess normal saline that you do not want to administer to the patient. If the patient is infusing fluids, stop the infusion pump and clamp the catheter. Scrub the cap with a CHG disinfectant pad or Pediatrics for 5 seconds and allow to dry for 5 seconds. Attach the stopcock system to the cap, making sure the stopcock is off to the patient. Turn the stopcock off to the sample syringe. Unclamp the catheter. Flush the normal saline and pull back waste depending on the patient size and the lab test to be drawn. Now turn the stopcock off to the waste and pull back the volume needed into the empty syringe. Turn off to the sample. Blood waste is not returned unless it is a PICU, NICU, ICU patient. In other areas, a provider order is required to reinfuse blood waste. Clamp the catheter and remove the stopcock system. Scrub the cap with Pediatrics for 5 seconds and allow to air dry for 5 seconds. Using push-pause technique, flush with 2 to 10 ml of normal saline depending on the patient size. Clamp the catheter and discard the syringe. If not infusing fluid, scrub the cap with CHG disinfectant pad for 5 seconds and allow to dry for 5 seconds. Unclamp the catheter and flush with heparin. Clamp the catheter and discard the syringe. Fill the specimen tubes using the blood transfer device, the female adapter. To avoid risk of accidental needle stick, it is not recommended using a blunt tip needle to fill the lab tubes. Apply labels to the specimen tubes immediately at the patient's bedside.